The strike in the public sector continues though, and apart from the violence that broke out last week, there's also the economic impact to consider there. Joining me with more is Andrew Levy, Labour Analyst at Andrew Levy Employment. And on the line we have Frost Sullivan, Healthcare Programme Manager, Lizelle Wentzel. Andrew, Lizelle, thanks very much for joining us today.
Delighted.
Andrew, the public sector strike, not unprecedented. We had one a few years ago, but this one seems to be a little more violent this time, and both sides appear to be digging their heels in a little more firmer than previously.
Stephen, I think we could be looking at the high noon scenario here, which I sketched in discussion on this channel a little while ago. There has been an increasing tendency towards violent and unlawful behaviour in strike action over the last 2 years, particularly more marked in the public sector. We now have a situation where government really has to respond very, very sharply to not only employees but also citizens who are actually just giving the law the finger and acting in contempt of a court order. Workers like nurses and police should not have gone on strike in the first place because they are essential industries. The other issue simply is that having taken a fairly firm stand, government is pretty much committed to holding its position. And the strike's going to go on for quite a long while yet because the gap between the parties is a very, very significant one. And until such time as the unions adjust their expectations and workers realise they're not going to get the 8.6% they want, then in point of fact there isn't much hope that it will end. Now, whether or not government will give them a face saver when this is needed is a little unknown.
Is that what we need a face saver here?
Well, at this stage, I think the unions still believe, or the employees still believe, they're going to get what they want. The short answer is that they're not. And when they want to come back to the table, they will need very badly a face saver. I don't know that government is going to provide that. And on that scenario, we're looking at another 2, 3, 4 weeks. Now, I think the most likely way forward is, one, we're going to be looking at implementation of the wage increase to try and make it attractive for those who want to return to work to do so. Because
this is no work, no pay, isn't it?
Well, it always is. I mean, strikers don't get paid. That's nothing new. But I think more importantly, we're likely to be looking at a mass dismissal scenario for those employees who, in fact, are in breach of court orders, which, of course, becomes a little bit difficult given that if you fire all your nurses or all your civil servants, you're going to have to rehire them because you need them again. So that in itself will create a bargaining chip. But I think we're still looking at an escalation of the unlawful behaviour and government really has to stand up to this one. So it's still going to go on for a while.
Well, Lizelle, let's bring you in here because we did have footage last week outside the Helen Joseph Hospital here in Johannesburg. Some pretty violent scenes. Is this something you've witnessed before, or like Andrew, do you think that we have seen a step change in these strikes?
Yeah, I think, Stephen, the big worry for us is certainly looking at the healthcare industry is to just see how the scenario actually planned out and how the private sector is now jumping in to kind of help our public sector. And I think the biggest worry, in our opinion, really is what is this holding for healthcare's future in South Africa? There's this big NHI that's being planned, and we're not hearing much about the NHI, how it's all going to happen. But this certainly is giving us a kind of a pre-taste of what it may be like. I mean, healthcare cannot afford mass dismissals. We don't have enough staff as it currently stands. And what we're seeing now with public sector patients being driven into the private sector who can only cope with X amount of people, we're actually seeing that patients are being turned around and have to go back home. So you may be in an emergency state, but not necessarily have the capacity to being helped. And I think the big worry is what is going to happen in the future, and can South Africa really afford to implement an NHI?
Well, Andrew, I see you've got a bandage on your hands. Were you turned away at the hospital? Did you get in first time you went?
Yes, I did, and I had a small operation on my hand. But I think the point that I want to make is if we get into a scenario, speaking only of nurses now, remember there are a lot more people on strike, where there are mass dismissals, or in fact there seems to be no breakthrough, then it is more than likely that they will seek to spread the strike on a sympathy basis to the private sector. So there will be increasing pressure on union members in the private sector to go out on a sympathy strike. And that's going to give the courts a difficult time because constitutionally they have the right to do so. Now, they would need a 2-week notice period, so it would take some time. But again, if they persuaded them to come out on an unlawful basis, unprocedurally, then the crisis shifts up another notch.
Well, Lizelle, the threat to strike workers who are working in essential services and may not strike, do you think that could have the desired effect for governments, or do you think that they might just dig their heels in firmer?
I'm sorry, I kind of lost you there for a few moments. Can you just repeat the question?
Lizelle, the threat to strike, to fire striking workers who may not strike, do you think that could have the desired effect, or do you think that it might just make unions dig their heels in firmer?
Oh, my golly, I'm sorry, I can't hear your full question.
What's your view on that, Andrew?
Look, I think mass dismissals unquestionably are going to make the unions dig in, but it becomes a tactical issue. The reasons that employers go for mass dismissals, and it's not something that should be done lightly or something that I recommend, is simply because they want to change the nature of the dispute and replace a wage dispute with a far bigger dispute about, have I got a job? So if there is a dismissal, it's only going to be tactical. It's not the intention to get rid of these workers once and for all. But the other difficult question is the one that the courts face, and indeed standing behind the courts, the government, because what does one do when a large segment of the population says to a court, I will not obey your order? Now, that really is, it's not civil disobedience, it's worse than that. It's more than that. And under those circumstances, a government's first response has got to be, amongst other things, to call in the troops, almost a state of emergency. Well, we know already that the Defence Force is helping in the hospitals. So, we're part of the way down the line, but it really is a significant threat to not only, one doesn't want to over-dramatize this and say to stability in the country, it's not, we'll get over it. But it certainly is a very significant threat to the perception overseas, particularly in the face of the wonderful taste which the World Cup left in everyone's mouth. This is most unfortunate.
Lizelle, what are the implications of this for private sector patients, those who pay their bills or have medical aids that pay their bills for them? Is there an impact on them at this stage?
Well, absolutely. I would think if I'm a private sector patient, which I am, and I'm paying my medical aid fees, surely when I arrive at the private hospital and I require some procedure or some help, that I would be able to walk in and get that help. And certainly from sources that we've heard is that some of those patients were asked to go home and come back when there are emergency, when it's really a state of emergency. And that is a worry. It's going to have an impact on those patients, especially if you're going to be required to pay more towards a future NHI. So you're already paying your medical aid, so you're expecting a certain type of service. And you may, as a taxpayer, even be burdened with more towards an NHI if this comes off.
Andrew, are unions being totally unreasonable with their demands? Can governments afford more, or would the wage bill just balloon totally out of control?
I think you need to divorce the question of the reasonability of the union's demand from, is it affordable? At the end of the day, I try and avoid making comments on whether it's reasonable or not. The strikers can make, or union members can make any demand they want to. But I think that if you look at it and you simply say, is it warranted, is it justifiable, the answer is absolutely not. We know that in terms of productivity, the public sector is abysmal, so there's no basis of arguing we've created more, we want a fair share. If you look at comparability, which is a hugely important factor in determining what people ought to be paid or where settlements will go, then in point of fact the public sector is usually at the bottom end of the wage distribution. It's now towards the middle or upper end, and in any event on a comparable basis public sector employees are generally very well paid. If you look at affordability, which is the other important determinant of what is paid, government clearly cannot afford this. It means that if settlements are at this level, tax rands will be deflected from areas where they should be delivering services into the wage bill with no necessary increase in productivity. We're going to have a situation where it's going to add to inflationary pressures, it's going to decrease the growth potential. So all in all, no. this is a step too far in terms of the settlement, both from an economic and financial point of view, but also in terms of the just the question of where the authority of government lies.
Have we set a precedent for this, though, with earlier wage settlements? Because we've had a number of wage settlements well above 10% this year. I can think of Transnet, Eskom, municipal workers. They all got wage settlements 10% or north.
Now, these are very, very important precedents. Not all of them were 10%, but they were certainly at the higher end of the wage distribution. And without question, the public sector over the last 2 years or so, in fact probably even more, has been settling at levels which exceed the private sector. That's not what you would expect. It's not what is necessarily warranted. So all of those add to the upward expectation, the upward inflationary pressure, and have led indirectly and directly, in a manner of speaking, to the current situation that we face.
Well, Lizelle, of course, you mentioned the National Health Insurance scheme just a short while ago. Do you think the government will be taking a look at what we're doing at the private and public hospitals at this stage, and perhaps think twice about the NHI, or at least push out any talks of forming an NHI?
Yeah, Stephen, I think since we heard the word NHI the first time, I think that's been the question right from the word go. I mean, can we do this? How are we going to do it? And I think that's exactly the reason why we have not seen any plan in place yet, as they promised by the end of last year, earlier this year, and middle this year, and we've still not seen a document coming out. So, I mean, this situation now is definitely showing us, I mean, two scenarios, in my opinion. The one is that if they want to bring out an NHI, it's going to take time and very careful planning, and certainly private sector would have to be part of that plan. And the second point actually is that the country is just not ready for it yet. I think there should be a larger emphasis on fixing the public sector and having a plan for that in place instead than trying to implement an NHI that they reason will be able to fix all the problems, because clearly those problems cannot be fixed by any such initiative.